Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe is used to treat multiple sclerosis, MS. It is not a cure for MS, but it may help to slow disease worsening and decrease flare-ups of symptoms such as balance problems, numbness, or weakness. The recommended dose of Rebif is 22 micrograms injected under the skin 3 times a week, with at least 48 hours between doses. It is best to take Rebif at the same time on the same 3 days each week, for example, Monday, Wednesday, and Friday. Before starting to use Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe, make sure to read the medication guide and instructions for use provided by your pharmacist. It's important to ask your doctor or pharmacist if you have any questions. If you will be using this medication at home, your healthcare professional will teach you how to prepare and use it. Before using it, always check the product visually for particles or discoloration. If you see either of these, do not use the liquid. Make sure to learn how to store and discard medical supplies safely. To make the injection more comfortable, take the medication out of the refrigerator and let it warm to room temperature for about 30 minutes before injecting. Do not warm it in any other way, such as in the microwave or hot water. You should inject this medication under the skin as directed by your doctor, usually 3 times a week, at least 48 hours apart, such as Monday, Wednesday, and Friday. It's best to use this medication near bedtime to reduce side effects. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. Do not inject into skin that is red, sore, scarred, or infected. Inject this medication in the thigh, abdomen, buttock, or the back of the upper arm as directed by your doctor. Make sure to tell your doctor of any skin reactions that do not go away after a few days. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce your risk of side effects. Use this medication regularly to get the most benefit from it, and try to use it at the same time for each scheduled dose. Remember to tell your doctor if your condition gets worse. Some common side effects of Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe include pain, redness, or swelling at the injection site. You may also experience flu-like symptoms such as headache, tiredness, fever, chills, and muscle aches when you first start this medication. These symptoms usually last about 1 day after the injection and improve or go away after a few months of continued use. To lessen these side effects, you can inject this medicine at bedtime and use fever reducers/pain relievers such as acetaminophen or ibuprofen before each dose. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, you should still tell your doctor right away if you experience any serious side effects, such as changes in mood, feeling too hot or cold, easy bleeding/bruising, signs of kidney or liver problems, new or worsening symptoms of heart failure, or seizures. Additionally, Rebif may lower your ability to fight infections, making you more likely to get a serious infection or make any existing infections worse. If you notice any signs of infection, such as a sore throat that doesn't go away, fever, chills, or cough, be sure to contact your doctor immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Before starting Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe, make sure to inform your doctor if you have any allergies, especially to human albumin. Some brands of this medication contain albumin made from human blood, which has been carefully tested, but there is a very small chance of getting infections from the medication. Prior to using Rebif, discuss your medical history with your doctor, including any bleeding or blood problems, heart problems, liver disease, mental/mood disorders, seizure disorder, or thyroid disease. It's important to note that using Rebif can increase your risk of getting infections, so avoid contact with anyone who has an infection that may easily spread. Before getting any immunizations or vaccinations, let your healthcare professional know that you are using Rebif. Additionally, Before having any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Rebif should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. This medication can pass into breast milk in small amounts, but it is unlikely to harm a nursing infant. Be sure to consult your doctor before breastfeeding. It is important to be aware of potential drug interactions that may affect how Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe. If someone has taken too much Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. You may also need to undergo lab and/or medical tests, such as a complete blood count or liver/thyroid function tests, while you are using this medication. Make sure to keep all of your medical and lab appointments. If you happen to miss a dose of Rebif, use it as soon as you remember, and then skip the next day. It's important not to use this medication 2 days in a row, and never double the dose to make up for a missed one. Just continue with your usual schedule the following week. This will help maintain consistent levels of the medication in your body. When storing Rebif, with albumin, 22 mcg/0.5 ml subcutaneous syringe, it's important to keep it in the refrigerator away from light. Do not freeze it. You may store this medication at room temperature for up to 30 days, but refrigeration is better. Make sure not to store it in the bathroom and keep all medications away from children and pets. It's important to properly discard this product and it is expired or no longer needed. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.